going for the medical professionalism. Yeah, I know this is boring, ya. Apa? Nanti kalau nampak muka boring, aku suruh kau bangun lagi. Yeah? Alright, yeah. I had one experience delivering a lecture to a group of very tired medical students. Yeah. No matter how interesting my lecture was, they were so tired. So what did I do? I end up giving this lecture with me standing and them standing. So dia pun berdiri, so tak bolehlah tidur sampai berdiri So bila nampak segar sikit, I suruh orang duduk pula, you know. I might have to resort to that lah, because bagi lecture ni kan memang letih. Yang tak letih tu menyembang tadi tu, tak letih lah. Okay. Now this is medical professionalism. Thank you Dr. Halizah. I always enjoy listening to her experience. She might have a lot of similarities to you, being somebody trained in overseas. Macam saya tak ada yang itu tu. Okay, so that's why we are complement. Kalau we are bebesan ke apa, nanti aku beritahu kau. Next slide. Next slide, Muiz. Kau gelak juga aku. Alright, sorry, Muiz, see you. Okay. Now, these are the content. Again, an overview on medical professionalism. I'm not going to go so much detail on that. But I want to introduce to you about this tadi ni, PPD tadi tu. Bukan perempuan dominan, tapi professional and personal and professional development, and why it is so needed in medical training. But of course the challenges as well. Then I want to introduce to you the PPD module, which more or less implemented by my unit in the medical education department, which is actually integrated into the curriculum of UKM. So just at a glance saja, tengok apa bendanya yang we buat. Boleh? Okay, so mana tahu dapat isteri ke suami orang UKM, medik UKM nanti, so kau kata bang PPD bang, so dia tahu apa bendanya. Okay. Now next slide. Now medical professionalism is actually a non-technical virtue. It's not something you can hold, something you can. It is non-technical. That's why some people rasa this one cannot measure lah. Kalau misalnya palpate the abdomen, kita boleh palpate. But the professionalism that comes with the palpation of the abdomen tu is something you macam tak boleh nak ukur sangat selalunya. Hence orang selalu kata this is actually the soft part, the soft skill, the hidden curriculum. But it is mainly virtues and practices that typify the caring and competent physician, including placement of patients beyond self. Ni maknanya semua patient dulu. Ini bukannya berkorban hingga terkorban, tidak. Tetapi maknanya is always thinking about other people. I do not know how to explain that. If you already had that, I think you are fine lah. Tapi yang belum ada ni, so mostly you need to learn that. Okay, next slide. This is the principle oriented framework of medical professionalism. You must be excellent. You tak boleh jadi doktor-doktor biasa je. Agaknya kalau subjek lain, kalau dia 65% je pun kira dah okey. Kita ni, kalau ada 10 causes of sudden loss of consciousness in a diabetic 39 years old man contohnya, daripada 10 you should at least know 8. Faham tak ni? Because we're talking about life ni. You tak boleh lah pass exam tu sebab you hanya tahu 5 je daripada 10 tu. That's not good enough. Can you imagine or not? Our standard cannot be 50%. It has to be 7 to 8 macam tu. 70 to 80%. That's why the standard is always kept very high. Dan fail dekat medical training ni memanglah dia memang. Kalau kawan-kawan you yang lain tu tak pernah fail, you pun dulu straight A's je. This is where most probably failing an exam is not really fail sebenarnya. It is an opportunity for you to be better in those areas. Okay. Now, you mesti ada juga humanism. You mesti ada accountability. Yang accountability ni payah sikit. Sebabnya nanti bila you buat, you have to be responsible. Contohnya, patient tu patutnya kena buat bandage kat sini contohnya. You buat bandage kat tempat lain. And then orang tanya, siapa bandage ni? Tak tahu, tak boleh. You kena, saya yang bandage tu. Kenapa you manage ni? Explain. Because you have actually done something and you are accountable to that. Itu tu yang you are susah sangat nak terima, ya, atau nak buat as a young person. All this welcome best, buat something orang lain yang buat. That's why kadang kita tak suka jadi leader sebab apa? Accountability. Orang macam Yazan ni agaknya dia suka jadi leader sebab dia very accountable agaknya kan, ya. Selagi dia ada, kita pun senang hati. Sebabnya apa-apa entah Yazan, apa-apa dah Yazan. Tapi as a doctor, you are going to be a leader. You are going to be a leader. Apa-apa you kena accountable to that, ya. Okay. You must also have altruism. In fact, the medical professional, ya, dalam medical profession inilah, ya, the word altruism come up again and again. Altruistic, dia tak ada tempat lain. Ya, computer programmer, be altruistic tak adanya. Ya, the medical ni maknanya apa? Mendulukan orang, ya, putting patient's interest above the rest. Next slide. Yang ini behavior. Apa pula behaviornya doktor yang profesional ni, ya? You have to keep on learning and improving. In my survival tip, I always say that. Learn some more. You never had this, oh aku dah, siapa yang paling terror kat sini kalau tak aku ni? Tak ada, tak boleh macam itu. Ya, mesti sentiasa rasa ada ni, ya. And then, because you want to improve, you will seek feedback dari orang. Ya. So, bila masa you dapat feedback? Masa exam lah. Itu yang you cherish sangat exam tu. Ya, saya sukanya exam macam tu, ya. Mesti macam tu. You have to have a right attitude to exam. Macam yang survival tips tadi kan. Actually exam tu, sorry lah kalau aku tak suka sangat exam. Pasal apa kau jadi student? Ya, teruk betul lah maksa ni exam. Saya ingat masa saya student, saya telefon rumah pak tengah nak exam ni, doa ya. Saya lagi minta exam je tak habis-habis tu kan. Memang itulah kita kan. Kenapa yang kena banyak sangat exam in medical ni? Because we need to know how far we are or how close we are. Exam ni dia sebenarnya macam signboard tu je tau. Yang korang nak pergi daripada Prague nak datang sini ni, ada berapa banyak signboard? Ya? Sekarang ni kau tak tengok signboard apa? Kau punya papago, tom-tom lah, gamin je yang ada. Turn left, ya? 300 meters, turn right. Orang buta pun boleh sampai. Ya? But then this signage is going to tell you, ya, kata you nak pergi Penang, ya, 420 km. So you know you jauh lagi. And the signboard is not the aim. That's why in exam kita kata you need to pass through the exam. Maksudnya you kena pass through je, bukannya you kena pergi kat exam kat signboard tu. Faham tak? Engkau kalau nak pergi jadi doktor ni, ya, exam tu adalah sekadar signboard. Kau bodoh tu, bawa kereta sampai kat signboard ni. Belum sampai lagi. Okay, naik lagi sampai signboard tu. No. The signboard is only telling you. So exam is supposed to let you know how far or how close you are. Ya? Kalau lah signboard tu kata tak pas lagi, maknanya jauh lagi lah tu. Tak apalah. Ya? Now, the other one is, ya, so you must have feedback ni semua. Caring and communicating, ya, with patient. Yang ni banyak kali sebut kan. Next slide, ada satu lagi. Interprofessional relationship. Capacity skill building yang saya nak bagi petang ni is to prepare you for this. You are not going to work alone. You are going to work with your nurses. You are going to work with your pharmacist colleague. You are going to work with your physiotherapist. You are going to work with the medical welfare officer. So kalau you tak belajar bahawa it is actually about teamwork, respectful, for one another, itu yang nanti jadi doktor. Yang you ingat semua orang tu, ya, kena cium tapak kaki you tu. Ya? You treat your nurse macam, ya, macam lah marah-marah macam tu. You are not respectful. Kalau nurse you suddenly, ya, mogok, buatlah doktor, you kau pandai, buat sendiri. Menangis you kat situ. So you better make sure, ya, you know how to, ya, have this teamwork with you, ya, and managing responsibility. Okay, let me tell you, kau jalan kat sini sikit, ya. Dia kalau ke sana je tu dah doktor tu, ya. Okay, saya duduk kat sini apa awak rasa? Apa? Awak ada? Lupa juga kan. Kenapa? Sebab saya masuk dia punya private space. Do you know your private space? Ya, private space adalah you depakan lengan you. That is your private space. Okay? That's why, katalah there's only 10 of you. There's only 10 of you, but this big a room. Saya kata, okay, saudara-saudari bebas untuk duduk di mana saja. Seorang duduk sini, seorang duduk sana, seorang duduk ni. Betul tak? Because you want to keep your private space. Yang paling comfortable hari ni yang belakang tu. Sebab saya di belakang, saya di depan, cuba saya datang. Okay. Kita start. That's why, as a doctor, you all must learn to be comfortable to come to people's private space, as well as allowing people to come to your private space. Kalau korang ni jenis yang tak suka, tak boleh jadi doktor. Pakcik tu sini. Ada seperti saya ni, tak boleh That's why if you look at the American, have you ever shake hand with an American? No, but you observe, they will put you there. You datang they hold you there. Dia tak bagi you masuk private space dia. Macam itulah And then tangan dia kat belakang ni tak tahu pegang pisau ke, dia tak tahu. But the Middle Eastern punya culture, bila you bersahabat tu, you peluk. Peluk kan. Kenapa peluk? So that I am without weapon. Bila berpeluk tu, you can make a body search sebenarnya, macam you dekat immigration kan. So if you have a knife ke, ada dagger ke, ada apa kat badan you, you wouldn't allow people to actually embrace you. That's about communication. In fact, kalau you salam dengan orang pun, if you want to dominate the person, you have to pegang, put your hand on top of that person's hand. That person is under your control. These are things you have to learn lah. Okay, coming back to tadi managing responsibility commitment. Next slide. Okay, yang ini is the principle of medical professionalism. That is the primary of patient care, welfare. Like I said, do no harm, beneficence, autonomy, your patient has their rights, and social justice, ataupun autonomy of justice. Next slide. Ni, you kalau tak ingat apa-apa, ingat rumah ni cukup. This is the principle of medical. You've learned what isn't it? Non-beneficence, which is do no harm. Beneficence, autonomy and justice. Autonomy pun dia ada 3 autonomy. One is physical privacy. Your patient has the right for their own body. Okay, puan, buka baju. Tak nak doktor, buka baju. Saya tak mau. Tu dia punya right. Okay, tak boleh paksa dia. Ada satu lagi autonomy, which is their decisional privacy. Autonomy. Dia boleh decide. Dan you tak boleh actually marah dia punya decision tu lah. Okay. The third one is the informational privacy. It is dia punya information about dia punya diseases semua tu is private. Ni apa kita panggil? Confidentiality. Jangan ingat ni, jangan professor you buat operation contohnya, keluar fibroid 2 kilo, kadang-kadang tu ada so you keluar lah iPhone you dah pad gitu, tunjuk lagi gambar gitu, masukkan dalam your FB, bagi tahu orang semua, korang hari ni aku tengok ada fibroid, hysterectomy besar kan. That is a breach of confidentiality, because you did not ask permission from that patient who is still under anesthesia that you are taking that picture of the fibroid. Alah doktor, bukannya tahu, ya ke? Betul anak dia entah dekat mana, ini hospital mana? Hospital HM. Agak-agaknya bila dia ambil ni? Ni hari masa mak aku ni operation. Siap kau. Okay, so delete semua tu. My student adalah yang macam tu, jenis tak perasan ni. Lepas tu I have one professor who always look into the IT ni. So Prof Hazmi call I pukul 11 malam. Kak, kau tengok sikit kat budak ni. Okay, terima kasih. Okay, tengok sikit budak ni, dia masuk kan fibroid ni. Dia kan besar fibroid tu kan, lepas kita dah keluarkan itu, masuk dekat dia punya FB. No. That is breach of confidentiality. Okay, justice also in 3 area. Justice in terms of fair treatment. Yang mentang-mentang lah yang ni cantik, itu je yang kau tanya, ya. Yang patient makcik macam aku ni kau tak tanya pun, ya. Tak boleh lah. Itu dari sudut, ya. Yang ni nanti petang ni kita buat capacity building, managing diversity. Fair dari sudut distribution as well. Ya, orang miskin, orang kaya kena dapat semua in terms of the health system, health care. Dan yang ketiga dari sudut fair kerana you are practicing according to the law of the land. Itu fairness. Ya, kalau macam tadi tu kan, you tak amanah ke buat tu maknanya unfair to your patient, ya. Next slide. So why is this current interest ni on professionalism? Everywhere in the world there is a sudden, bukan sudden lah, a comeback to this value. Agaknya kita dah sampai kat level advances in so many things, but then suddenly we realize something is missing. We do not want doctors who are so technically advanced but so morally backward, because it's going to cause a lot of trouble. A lot of misconduct kalau kita buat macam tu. So everybody is coming back to professionalism. Next slide. Yang ni masalah dia, how professionalism compromise. Tadi ada tunjukkan, ya. This kahon ni duit lah yang jadi, the driving force, about money, and then banyak error, inappropriate relationship, conflict, macam-macam. Next slide. Okay, I nak pergi that side pula, orang sebelah sana pun ke sini. Nampak, boleh nampak. Silakan nama anda cuba anda bangun explain je. Kau buat apa pertanyaan?
Dalam pokok dia tu bawah dan air putih dia tak nak gerak, dia tak nak mengumumkan.
Siapa dia?
Ni lah. Elah.
Dekat Hradec ni apa? Dekat Hradec dia somebody who is making this line, tapi dia tak nak kuih ni, so what is that? Now, this is a very important slide because masa you kerja kan, this is very common. Tulis dekat situ CVS normal. 1 week later landed in my ward with CCF. Masa kita examine, we can hear the murmur. Agaknya duduk sana di sini dengar murmur. Dia kata, puan ada tak doktor check jantung puan? Tak ada. Tapi kat situ do rhythm no murmur. Telefon. Dia bilang, hello, can I speak to Dr. So-and-so? Speaking. This is Dr. So-and-so from Chicago. Yeah, why? I'm so busy, you know. Main ni berapa kerap sangat kau dapat phone daripada HQKF ni kan. I just want to find out about one patient. I have so many patients. I know, but can you kindly just check on this one whom according to this record just saw you 1 week ago. Ya kan? Now we just want to know whether according to your record the heart was normal. So, ingat suara ni, Now she is in our CCU for cardiac failure because of a very tight mitral stenosis. We would have thought that the mitral stenosis cannot be just happening last week. Can I know whether you have really listened to the heart or not? No. And why did you write that? Alah, you know lah, I know. So, please don't embarrass yourself like that. You tak dengar. Okay? Next slide. So, actually, student must have this development throughout the 5 or 6 years. Any school that did not impose this, losing a lot of opportunity in planning and training you all. Next slide. So these are the determinants of clinical behavior. The education is one component of it, but you must also have reward and penalties, and you must have feedback and participation of everybody to tell you what happened to you. Next slide. Okay, the component dia, communication skill, human care, self-care. This is the personal growth. You kena tahu macam mana nak manage your time, your emotion, semua tu kena ada, ya. And then ethic law, ya, ethic and health law and medical humanity. Next slide. Okay, just a glance. This is very fast, ya. We all ada this PPD module dekat UKM. Next slide. The main objective is to produce doctor who are holistic, caring and professional. Next slide. So this is the reason we need to fulfill the Malaysian criteria punya qualification framework, ya. And then we assess them. Next slide. So these are the things, ya, in Malaysian punya higher education ni memang kena achieve. Okay, next slide. So for 5 years, ya, mula biomedical banyak, lepas tu makin lama makin sikit, tapi clinical pun mula ada exposure, lepas tu makin lama makin banyak. But personal and medicine society comes across the 5 years. Ya, next slide. Ni dia punya sub module. Ya, masa we all nak come up with this, we all pun tak tahu benda apa ni. Kan dulu tak kena ajar macam ni, but of course we learn, ya. Critical thinking, spiritual development, very important, ya. Because even if you are not spiritual, your patient become very spiritual when they are sick. Nanti dia tanya, doktor, adakah ini, ya, hukuman Tuhan pada saya, doktor? So dia kata, saya Tuhan-Tuhan tak main. Tak boleh, you have to address that juga, kan? You have to manage diversity, teamwork, everything, and adaptation skill. This is the personal growth. Yeah, you have to know how to manage your stress, public speaking, yeah, leadership. Yeah, semua tu. Next slide. Yang one yang tu kita ada separate module. Yeah, they are taught on its own, yeah, and assessed, and more on personal development. 3, 4, 5 they integrated into the clinical posting, yeah, and we assess there as well. Next slide. The activities, we have indoor, we have outdoor, we have formal and informal. So yang informal tu we have debate, role play, we have community service, we have interfaith dialogues, and a lot. Next slide. So dia ada 3 camp, outdoor camp throughout the 5 years. Yeah. Masa-masa mula dia start nak year 1, dia pergi camp dulu. Okay. And then masa dia nak masuk 3rd year, they have the 2nd camp, and during their year 5, they have the 3rd camp, which is at the finishing school. Yeah. Okay, next slide. So ni activity dia. They will have debate, yeah, small group session, not more than 10 people, yeah, and they have their facilitator. Okay, next slide. They have role play. Yang ini memang suka sangat, ya. Jangan jadi nurse lah, yang jadi ni lah, jadi pakcik Parkinson lah, macam-macam. So you really enjoy them doing this, ya. Nampaklah yang award, Grammy Award punya winner semua ada, eh. Next slide. The group project, yeah. Of course they have an outdoor, kena go across the ni. These are all ni lah, ya. Bina semangat, bina. Next slide. Motivational talk. Okay, these are my colleagues. These are not ustazah tu. Yeah, this is Prof Maya. You know Prof Maya, some of you tahu. Yeah, and this is actually Prof Ismail Sagab, who is a colorectal surgeon. Dia pakai ketayak tu macam ustaz. Yeah? So just talking on common thing. Okay, next slide. Aerobic, yeah? This is the time when we see them smiling from ear to ear. Yeah, and this is our team dulu, ya, Prof Lukman dekat dengan tu. Masa ni lah, ya, kita boleh pincit-pincit dia, ya. Ni lah, ya. Okay, next slide. Now stress management, ya. We have this telematch. Dia pergi blow-blow, letak, ambil all the alphabets. Hypercholesterolemia, ya, dia kena eja. Ataupun this one, ya, yang dah expired punya surgical gown, ya, kita gunakan untuk tu, ya. Okay, next slide. Jungle tracking, dengar ke? Bateri habis. On. Testing. Sikit je lagi ni. Okay, ya. So this is jungle tracking macam biasa lah, ya. But the facilitator pun kena track sama. Next slide. Medical explorers, we really love this, ya. Dia macam ada treasure hunt, ya. You can do that lah in the next cancer punya ni ke, ya. Very ni. But these are all medically based. Yes, all the station dia akan dapat a part of a jigsaw puzzle. Tapi bila cantum jigsaw puzzle tu, dia jadi satu medical certificate, MC. Tapi MC tu banyak mistake, so they have to correct the mistake. Okay, tapi tu saya punya rakan saya punya idea ni. Testing, okay. Profesor Ruzana dah meninggal pun, ya. So she was the one who has a very good idea on this. Okay, next slide. Now there is this white coat ceremony. All ada juga? Ada, ya? Tak ada, okay. At the end of the camp 2, we have this white coat ceremony. Kita kata it is not a lab coat, this is now a white coat. So the group leader, yang pakaikan dia is the dean. And then we all pakaikan untuk ketua-ketua group, and the rest of the people we wear. Lepas tu dia orang ada swan, ada buat ni. Next slide. Movie viewing. I recommend you all, movie ni you all kena tengok. Passion Adam, kalau buat movie kau tempat dia ya. Malam ni kau dah tengok YouTube lah dah. Part 1, part 2 je. Okay lah. Passion Adam, this is for Camp 1 because this is actually more for medical student life. Untuk Camp 3, Camp 2, this is a lot of issue on medical ethics in something the Lord made. Alan Rickman, I love Alan Rickman. Tahu kan Alan Rickman? Kau tak kenal kan? Alan Rickman ni yang Harry Potter tu, yang jadi cikgu, tak ingat lah nama dia. Tapi kat sini dia jadi surgeon. Professor Blaylock. These are all true stories lah ya, ataupun converted from true stories ya. And yang kat belakang tu is Vivian Thomas, was actually a very fine surgeon sebenarnya, tapi masa that time black cannot go into medical school, so dia tak boleh jadi surgeon, tapi dia jadi lab assistant to Dr. Blaylock, and he refined the technique to do corrective surgery for tetralogy of Fallot. That was the first heart surgery being done. So masa Blaylock nak buat operation tu, Vivian was not allowed to be in the Untuk because he's a black. Tapi masa tu kan, Blaylock tak boleh nak buat lah without him, because he is the one who always guide Professor Blaylock. So Blaylock juga ada panggil, and everybody was so unhappy because the rules then was that black tak boleh. That is actually the discrimination. Student suka sangat cerita ni. And we have a lot of discussion on it. Okay. Then the doctor ni untuk year 5, where this is a doctor, a cardiothoracic surgeon who suddenly diagnosed with a vocal cord CA, and masa tu dia jadi patient. It changed his personality. Very good. And kita ni bila jadi doktor, bila jadi patient ni begitu perasan. Next slide. We have this interface discussion, one of the most favorite topic for my student. Topik dia interface discussion on the concept of life and death. So we invite doctors from the respective religion, Muslim, Catholic. This is Chengka from the Buddhist Mental Health Association, and this is Javani from Hindu Sanggam. So tapi kita tak suruh dia cakap. Kalau presenter dia cakap boring. So we actually had students representing the faith to discuss on the topic, and these doctors are commenting on them. So yang forum dia panjang sangat. So yang duduk dekat kursi ni nanti cikgu lah semua. Okay, and then yang duduk kat kursi tu is the student. This is very proud, and the student is just representing the whole team ada kat bawah tu. So the Buddhist, so they have their own punya team. Okay, next slide. This is the joint activities that the unit did with the student body. So every year ada tiga aktiviti. Medical Play Carnival, this one dengan College Committee. Interface discussion tadi dengan the Asian Medical Student Association, UKM chapter. And you all ada bioethics symposium yang ni buat dengan PESIAP atau Persatuan Perubatan UKM. Okay, next slide. Macam mana assessment dia? Year 1 dia assess formative and summative. This is formative maknanya continuous assessment. Year 2 60 to 40%, lebih banyak lagi continuous assessment. Sebab benda ni kena dilihat secara selanjar. You tak boleh tengok dia just for exam saja. Exam memang pandai, orang pandai nak lulus exam ni. Tapi kita tengok ada one of my student tu very clever, tapi malas datang section. Fail BPD. Marahnya dia, datang bila Prof, I am in the dean's list, so I cannot fail BPD. Why? So bila dia macam tu, I telefon je dean, kena panggil dengan dean. Ya, banyak cantik, kau pandai sangat. Ya, dia IQ tinggi ni, EQ selalu rendah. Ya, that's your problem. Ya. Now 3 and 4 dia 50-50, but tahun 5 they are fully formative, tak ada exam dah. Ya, but they are actually assessed throughout the year. Okay, next slide. So assessment dia ada banyak sudut. This is what we call triangulation. They have their own self-assessment. They assess themselves. They have of course the patient to assess them, macam saya cakap tadi. They have the mentor, ya, atau kita panggil the personal mentor. They are not academic mentor. They are personal mentor, ya, and also the peers, ya. Okay, next slide. Ni at the end of year 5, my student will get this statement of attainment. Beside the transcript, ya, Senat mengatakan dah lulus macam tu. They will have this, whereby contohnya Farin binti Masra, our best student for the year 2010, has successfully attained PPD level 5. Apa dia PPD level 5? This is excellent conduct, blah 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 blah, signed by me and the dean. So this seems to be really putting our graduate on the high rank of choice. Now that my student, my graduate can apply Singapore, for Singapore employment. So antara UM dengan UKM, sekarang dia banyak ambil UKM punya, mainly because my student produce this certification. Okay, next slide. So this is actually just the next slide. Now, I'm going to stop here. Sebenarnya tentang professionalism is about the role modeling. So cikgu you tu, macam Prof, macam dah bisa cakap, cikgu tu yang penting. Kalau cikgu tu akhlaknya baik, anak muridnya pun baik. Kan macam yang kita kata, kalau cikgu kencing berdiri, anak murid kencing berlari. Ya, macam mana pun tak tahu. Boleh ke? Ya, tak tahu kan. So American teacher tells, cikgu yang biasa-biasa ni dia ajar je. A good teacher will explain, a superior teacher will demonstrate, and a good teacher will inspire. Baik, saya tunjuk gambar je. Okay, gambar, slide terus. These are the teachers who are also the facilitators of the camp. Kita tak engage orang luar untuk ni. Tapi memanglah ni orthopedic surgeon, ni pathologist, they are all our facilitators. Okay, next slide. So ni kita gambar macam tu, next slide. And this is our first PPD alumni, maknanya yang ni pada tahun 2010. They are now finishing their housemanship very soon. Next slide. This is the graduation. Next slide. We won the Best Jury Award for Innovation in Medical Education, for the curriculum. So this was in India, so we won the first prize. Okay, next slide. Life is not measured by the number of breath we take, but by the moment that take our breath away. Eventually, after when you bring your student along, I selalu kata macam ni, I'm an obstetrician. The analogy pun macam obstetric lah kan. When the student comes in, they go into my uterus. I have a very big uterus, 200 over coming in. Okay, and then they will be stuck to me, and I will try to nurture them together with the rest of the me, and then I will deliver them. This week I'm delivering another 250 of them. The 5th of April nanti result dia orang. And siapa yang dapat tu, I pun potonglah cord tu, so that they will have to live on their own. But as a teacher, tu lagi. The moment they take your breath away, dia tengok budak-budak ni pakai macam ni lah. Ada student kata, Prof, taking your breath away, you will be hypoxic. Saya okey lah, understanding it literally, Okay, next slide. Okay, alamak, cabut dah. So thanks. I just want to show you this picture because last year you will see me wearing the same coat, kan? Janganlah pula marah, ada coat yang sama je lah kan. Tapi anyway, this is Harvard Graduate School of Education. As a medical doctor, it's very difficult for me to persuade myself to actually learn again. Especially because I think I know lah, education. But I realized that I was very humble because I was never taught in a proper way of the educational component. So I spent a month, 2 weeks in January, masa winter betul tu, ya. Another 2 weeks in May, ya, to go to Harvard Macy Institute in Harvard Medical School to learn how to be a better teacher. And over there I meet so many people. They are professors of neurology, urology, nurses, yeah, who are together, especially they are from the States lah. But one thing that we share, yeah, the passion and love to teach, yeah. And I do not know, yeah, how many of you are soon going to be teachers as well. But let me tell you, the best way to learn is to teach. Okay. So siapa yang rasa-rasanya nak lagi berkat lah ya, belajar jadi doktor ni, teach. Okay, teach as much as you can. Okay, and from that teaching you will learn that you are going to get a better understanding. Ya, okay, saya sentuh saja dulu. Terima kasih for your attention. Balik kepada Alif.